Hey everybody, welcome back to Prescription for Change Radio, brought to you by Project Opioid. My name is Dr. Kendall Ward, and I'm here with Dr. Philip Toll from Aspire Health Partners. Right, we know, and we've seen so much of this in the media, that there's so many people that are suffering right now, Dr. Phil. And again, where can people go if they need resources and are worried about their own mental health or the mental health of their loved ones?
Definitely Aspire Health Partners at 407-875-3700. And you hit number 3 on the auto attendant, which is seeking services for new clients. It's really key to reach out when you feel as though that you're in need of support and treatment, whether it's for mental health issues or for substance use disorders. That assessment is key because we can help you figure out what's going on for you and then direct you to the next level of care that may be the most appropriate.
Right. And so can people reach out at any time?
24/7. The phone is answered 24 hours a day, 7 days a week, because the desire to get help may happen at 3 a.m.
Right.
And so we're there when you need us.
Right. And what about a website? Are there resources available?
Yes. You can reach out to our website at aspirehealthpartners.com, which will give you a selection of the number of different services that are available based on county, based on whether you're male, whether you're female, whether you're an adolescent, whether you're an adult. Whatever the service may be.
Okay, that's great. That sounds like great resources. Well, thank you very much. And I'd like to welcome our guest, Mr. Kim Lopdrup, who is the CEO of Red Lobster and also the co-chair of Project Opioid. So welcome, Kim. Thank you for joining us. Just to get started, I just wanted to find out, really, you're the CEO of Red Lobster. You run an international company. You've got a few things on your plate, right? You're a pretty busy guy. So tell us, what made you want to get involved in Project Opioid, and really what made you want to work on this crisis?
Kendall, first of all, thanks for having me, and thanks for the great work you do on behalf of Project Opioid. The reason I got involved was because of really 3 friends having experiences that really had a profound impact on me. One was my friend Rick Van Warner, who I'm very close to, and he had a son get addicted to opioids, and we used to meet like weekly on Saturday mornings and have breakfast. I got to follow his family's journey as they tried everything to help their son get clean, and they tried one thing after another that didn't work, and I mean, it was unbelievable the emotional toll this took, the economic toll it took. Now, Rick and his wife are determined people, and their son actually is a determined guy himself. And the great news is he's not only a survivor, he's completely clean and doing really well now. But Rick wrote a phenomenal book based on his experience and learnings. The name of the book is On Pills and Needles. And again, knowing him and his wife, I mean, they're phenomenal parents. And it's like, man, if it could happen to them, this could happen in any family, if it could happen to them. And again, just understanding how many things out there that don't work in that people were trying was the first thing. The second thing is I have a friend of mine, Brad Rex, who was actually running a funeral home company. And he noticed all these young people were coming in who should not be dead, but they were. And it was because of opioid overdoses. And Brad's the kind of guy who said, I got to do something about this. And he started, a telehealth counseling company. And he educated me about just how easy it is to get addicted. I mean, people who take opioids for a single day have a 6% chance of becoming addicted. Somebody who takes it for 30 days has a 35% chance of becoming addicted. And yet lots of people were going home from not just the doctor, but the dentist with these prescriptions for 30 days of opioids. And so many people were getting addicted. And once they got addicted, it was, at the time taking like an average of 5 to 8 years to get clean for 1 year. I mean, it was very, very difficult. And that was before some of the more recent advances. But again, learning about that from Brad made a big impact on me. And the third thing is I had another person I got to know because I invested in his company. He seemed like a guy who really had it together. I didn't know anything was wrong. And one day I get an email and learned that he had died suddenly. of an opioid overdose. And I had no clue anything was wrong. And that made me realize there's probably actually a lot of people that I see, friends, employees, others in society who are struggling with this, and it just isn't visible. It's a hidden problem and a widespread problem. And then when my friend Tony Jenkins, who's the market president for Florida Blue, and Andre Bailey, who's the co-founder of Project Opioid, asked me to get involved, I said yes, and glad I did.
Given the your own personal experience with people that you know that are using, what might you, I mean, our listeners are in the same situation, knowing that their loved ones that are using, that neighbors are using, coworkers are using. Do you have any words that you might share with them that would help them, ways to intervene, that first step of recognizing that there may be a struggle, that they're struggling? How might you encourage someone to approach an individual that's demonstrating a struggle with using substances?
Well, first of all, to reach out and ask for help. If they're working for a company, that many companies such as Red Lobster have employee assistance lines where they can, even if they're not signed up for the company's medical program, where they can call and get advice. They can reach out to directly to organizations like yours, Aspire Healthcare, and you all are using the advanced treatment. Certainly, what the data would show is that the combination of treatment, medically based treatment, plus substance abuse disorder counseling is the most effective way to overcome opioid addiction, with a success rate that exceeds 90%. And so many people try other things, 12-step programs, whatever, and yet the data shows that they are at, in the case of 12-step programs, the national data shows that they are completely ineffective for opioid disorder. They may be effective, work for other things, but not for opioids. It's just too strong. The thing that works is the combination of medically based treatment with certain drugs like buprenorphine and Suboxone, and then counseling is the most effective combination.
Right. And absolutely. And we at Project Opioid are always a big proponent of the use of medically based treatment to treat opioid use disorder and to help people who are really struggling. Kim, I want to go back. You mentioned EAP programs, these employee assistance programs. And I think that can be such a crucial lifeline for people, especially people that don't have insurance, because we do have a large number of uninsured people who are probably listening to us today who don't have insurance and don't know where to reach out and don't know how to get help. So employee assistance programs are a great option. Aspire, I know, works with individuals who don't have insurance or have Medicaid, and there's a lot of different ways that people can get help. So I think that's just such an important point that I really want to emphasize, that you don't have to have insurance to get help. There are options in our community. There are ways to reach out and look for resources.
And the full range of resources are available. Kim's talking about medication-assisted treatment.
Right.
So there is funding, even if you don't have health insurance, that you can actually partake of medication-assisted treatment. And to Kim's point, opioid dependency really does need the medication-assisted treatment. That is, in addition to the counseling, which is always a component, or
Right.
should always be a component of medication-assisted treatment, is really key in overcoming the opioid addiction.
Yeah, we completely agree. And this is a major push for Project Opioid, as Kim mentioned, that to make sure that people are getting the cutting edge treatment, and you don't have to have insurance to get it. There are options, there are treatment options in our community. And I think that's a really important point. Now, Kim, since you are coming to this, you're the CEO of Red Lobster, you're not involved in public health, you're not involved in the day-to-day front line of the healthcare industry. So given your work with us, what's been the most surprising thing that you've learned about addiction in your last work with us over the last couple of years?
Well, again, as you said, I came into this just as a business guy, not as a doctor, but as I learned about it, first of all, I'm amazed how actually easy it is for people to get addicted. Like I said, somebody who just takes an opioid for a single day has a 6% chance of becoming addicted. It's something that affects all segments of society. This is not just people who were irresponsible or many of them were just following doctor's orders. It is very easy. It is very widespread. I mean, here in Central Florida, thanks to the data project that you're leading, Dr. We've learned that there are 64,000 people here in Central Florida, just in Central Florida, who are dependent on opioids. For perspective, that's about as many people as who attend the University of Central Florida, which is the second largest university in the entire country. But the other surprising thing to me is just how solvable these problems are. Back when we were starting, I mean, you'd hear so many stories of failure, of people seeking answers and failure after failure after failure, and then they die. And particularly once the drug dealers started cutting the heroin with fentanyl and carfentanil, which are dramatically stronger than even heroin, dramatically, and the fatality rate was just escalating like crazy. I mean, where more people are dying of opioid addiction than are dying of car accidents in the United States. But yet, there are treatments out there now identified, now proven, which have extremely high success rates. If we can just educate enough people and get them into the right kind of treatment, you can get great outcomes. And almost immediately, people can function again and be back, working their job, taking care of their family, and having a good quality of life almost immediately.
Kim, I'm wondering if you mentioned the employers and the struggle that I'm sure our listeners have on their minds too, that if they address the issue, particularly of opiate dependency, but any substance use disorder, and they're working, I know that from our side of the treatment side, that's often an issue that they have. It's a barrier. I can't come in because I got to go to work, and that's going to be problematic. Very often I'm afraid to reveal that I struggle with substance use disorder to my employer. I'm going to lose my job. I'm going to lose my insurance, and all the subsequent things that happen when we lose income. Do you have any thoughts about how employers may address the issue of substance use disorder in the workplace? We do know that, some astronomical number of workdays are lost due to substance use disorders.
Billions of dollars in productivity. Yes.
Yeah, that's a really great point. A lot of people are very reluctant to admit they have a problem for fear that they might be fired. They might be discriminated against in some way. And it actually is really important for employers to create a culture where it's okay to ask for help and to let employees know we care about them. We want them to be healthy, productive, and by the way, alive. One of the things we did, last October's what is it, Substance Abuse Disorder Month, or where we actually did a video for employees talking about how widespread this problem is. Some of the tips to avoid, and we passed out education materials on some of the dangers, how to avoid getting addicted in the first place, but also some of the resources we had available for those who needed treatment. And our goal was to create a culture where it is okay to ask for help, to show the resources we're putting there because we do care. And we know we have people who are wrestling with this, and we want to help them. So it is really, really important to make it okay for people to ask for help and to point out where those resources are. In our case, we've got a phenomenal head of benefits named Joel Taylor, who has put together a really effective program that focuses on both prevention and treatment. On the prevention side, we educate employees about the risks. We also put in place this advanced opioid management program with our pharmacy benefits provider, where every time an employee on one of our health plans gets an opioid prescription, they have an expert looking at that prescription and saying, does this make sense? And if they think it doesn't make sense or might not make sense, they actually call the doctor and discuss it, and will share studies and educate the doctor. And it has been startling that in literally a majority of cases where they've contacted the doctor and discussed it, the doctor has chosen to modify their prescription, in some cases switching from addictive opioids to non-addictive painkillers. Even if they still prescribe an opioid, 60% of the time they changed it from a longer lasting, more addictive opioid to a shorter lasting, less addictive opioid. And they reduced the average fill in terms of number of initial pills by like 2/3, which means people aren't taking it as long unless they absolutely have to, and you avoid the problem of a bunch of pills in the medicine cabinet where the kids might get, or might find their way into the wrong place. But she's also put together a really good treatment, creating treatment options. First of all, through our employee assistance program, even people who don't sign up for our health insurance plan are able to get counseling sessions on this or other things. If they, we self-insure, we make sure our insurance covers medically based treatment for those who need it. We make sure we got rid of the, there used to be all these long approval processes, and you can't have that, when you're dealing with opioid addictions, because if somebody decides they want to get clean, you really need to provide help like within an hour, or else they're going to be out on the street, and you're just going to lose the opportunity. And very often, the next time you see them, they're dead. You have to provide it immediately. So since we self-insure, we were able to modify, to basically eliminate the approval processes, make sure we cover the best medically based treatment and things like that. And our data for results has been really incredible. We share that with Project Opioid as part of Kendall's data project, actually, where she's measuring the effectiveness of all kinds of things so that we can learn what best practice is. Tony Jenkins, market president for Florida Blue, said we've got the best data he's seen. And, we've had a lot of other companies want to take a look at it. So it's both prevention and then treatment. The other thing is, particularly for businesses that where an overdose is actually likely to take place, as might happen in a number of businesses. Interestingly, we can't find evidence of it happening on site ever at a Red Lobster, but there certainly are businesses where multiple people have wound up dead in the restroom of a gas station because of shooting up. And if you're in that kind of situation at all, where have naloxone on site, so that if you find somebody who's overdosed, that is very effective at saving people. So that's the other key thing for employers.
I think that's a great point. And just to clarify what Kim's talking about, naloxone is actually an opioid overdose antidote. It's a reversal agent, and it's known by the brand name Narcan. And Narcan is an amazing tool for reducing deaths from overdose. So Narcan is something that individuals can have on hand, and it's a simple nasal spray, and you can spray it up the nose of someone who's overdosing, whether it be, as Kim mentioned, in your place of work, or it can be in your home. And it's something, Narcan is something that should be readily available. And it's something that if you are at all concerned about yourself or someone in your social circle, your friends, your family, about them overdosing, Narcan is something that's super simple to have on hand. And actually, you can get Narcan from our Project Opioid website. If you go to projectopioid.org, and I caught it. You go to projectopioid.org, you can request free Narcan, and we will send it to you directly through the mail. And it's a super easy way to save a life. And we can send it to you free of charge in the mail, and something that to just have on hand, even if you don't know somebody immediately that you see regularly, it's definitely something that you can have. We've got stories of our Project Opioid board members having it in their car and, having to do a reversal on someone in a parking lot of a Walmart. There's a lot of times that this kind of thing can come in handy. So thank you so much for bringing up Narcan, Kim. That's an excellent, excellent point. And so just in summary here, Kim, if you could talk to a Red Lobster employee or any employee right now who is worried about themselves, they're worried about their mental health, they're worried that they're at risk for overdose, they're worried that their friends or family are, what advice would you give to them? What could you tell our listeners right now?
Well, I mean, it would depend on the situation they're in. First of all, let's realize during this pandemic that's affecting a lot of people's mental health, regardless of their situation. I think I read something like 40% of Americans right now have literally got a diagnosable mental health issue, which is unprecedented. And unfortunately, a lot of people are self-medicating because of that, and it's leading to higher rates of drug use, alcohol use, and by the way, abuse, and that's having very significant health impacts. Actually, we've seen here in Central Florida since the pandemic started, the number of opioid deaths is up 60% from overdoses in Central Florida. And keep in mind, pre-pandemic, it was already killing more people in car accidents. It's since the pandemic, it's up 60%. And while the pandemic may be on the downswing now, actually the number of cases of COVID diagnosed per day is down by half in the last month.
Right.
The addiction issues that have been created will be longer lasting, and we tend to think of opioids as being, or drugs as, an isolated issue. Actually, it even relates to COVID. I just saw a study from National Institute of Health. Somebody who's addicted to opioids has a 51% more higher chance of getting COVID. And if they get it, they have a 37% higher chance of being hospitalized and a 45% higher chance of dying. So it's actually fascinating how these two epidemics are, in many respects, related. But so anyway, if you're in that state, try to reach out, get help. Your employer may have an employee assistance line. Aspire can provide counseling. United Way provides a number of resources, and you can access them by dialing 211. But if you have an outright addiction, it's really urgent that you get help for that, because it only gets worse. And the sooner you treat it, the better your results are going to be. And as I said, we have done a pretty large data project. It is crystal clear what the best solutions are, and there are medications you can take now that are covered by Medicaid and many insurance plans, that the combination of medically based treatment and substance abuse disorder counseling is more than 90% effective, and most people can literally go back to their jobs and be functioning normally again almost immediately, with a very, very high long-term success rate, as long as you stay using the medication and showing up for your appointments. Very, very, very high probability of success. So don't wait, reach out, get help. And again, talk to your employer, talk to your pastor, check the Project Opioid website, call Aspire Health Partners. There are a lot of really good resources there that are available. So take action today.
Right. I think that is a great point, and one that we've heard over and over again as we talk about this, is the immediacy of things. If you are struggling, reach out and as soon as you can, and they can do that by calling Aspire. So can you give us that number again?
Sure. Aspire Health Partners at 407-875-3700. hit 3 and you'll go directly to the access center that can assist new clients in making some assessments and recommendations. I'd like to make one more point.
Absolutely, please.
It's really important what Kim is saying, and I don't know that we have even looked at it yet, is the long-term mental health impact of COVID-19.
Absolutely.
We're not done even when we're all immunized and the numbers are down to 0.
Right.
There's a long-term impact, and substance use and mental health go hand in hand very often.
Yeah.
70% of those living with a mental illness have a substance use disorder because it's the self-medication that Kim's talking about.
Yep.
So that is really key that we're addressing both of those issues. And as we address coping with, post-COVID-19, it really does mean addressing the opioid addiction, the overdose epidemic, and the mental health concerns.
Right, absolutely. And so thank you very much to our special guest, Kim Lopdrup, who is the CEO of Red Lobster and the co-chair of Project Opioid. Thank you so much, Kim, for all of your work that you've given to Project Opioid over the last couple of years. We certainly could not have done it without your amazing leadership. And again, thank you very much to my co-host, Dr. Philip Toll. Thank you all for listening to Prescription for Change Radio, and we'll be back. Thank you.